Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. So I'm going to show you a soft tissue mobilization or massage technique for Achilles tendon issues. Okay, so I know the common term for a lot of these problems, your Achilles tendon issues, is Achilles tendonitis, which actually is incorrect. There's no inflammation in these chronic tendon repetitive strain type of injuries. Okay, and Achilles tendon issues are quite common in runners and lots of other athletes too. So which is the same thing with patellar tendon, quadricep tendon, various tendonitis type things. So the correct tendonitis, the term tendonitis is not correct. Okay, tendinosis or degeneration, thickening, wear and tear of that tendon is a better term to use. So same thing applies for Achilles tendon issues, especially those chronic injuries that people keep getting. And it could be due to micro tears or repetitive irritation that's taking place on that tendon, which has made that tendon get thickened, painful, and the collagen fibers are not laid down properly. They don't glide as easily. The tensile strength is down, so they're weak and they don't have good mobility. Okay, because they're kind of adhesed and scarred down. So, so here's your Achilles tendon. When we're talking about, okay, remember it's a continuation of your calf muscle. Okay, here's my gastroc. Underneath is the soleus muscle. It comes down and then it becomes into your Achilles tendon right about there, coming in and attaching all the way out through here on your calcaneus. Okay, which is your heel bone. So most of the problems, and I've done another video on this, a self-massage video also for this problem. This is, I'm going to show you, so if you have another person who can help you with this, you can do it this way too. So as we have said in the past, you can have the irritation or thickening all along that tendon, usually about 2 to 3 inch worth of area above the attachment site, right about here. It can be problematic, anywhere along there. And of course, at the site of attachment through here, you can have thickening around there too. And sometimes you might get some bumps that are formed around there, which could be bone spurs or thickening of because of repetitive irritation. You have bone growth essentially there. Okay, so that can be quite painful at that site, attachment site also. So along here or down through here. So we want to find out. So let's say we're going to target the Achilles tendon to do some cross friction mobilization or also a scar tissue mobilization, where we're going to get in there to break the adhesions and thickening along that tendon and then promote some blood flow and circulation and to facilitate that healing process. And then you can work on more strengthening things afterwards. Okay, so you can have, remember, here's the tendon. You can have problems anywhere along that tendon. As I said, you can have the problems on the posterior side, which is the back side, anterior side, which is going to be the front side of that tendon, along the lateral side, outside, and medial side on the inside. So anywhere along those areas, you can have problems. Okay, very often, very common I see is on the medial side through here. Okay, which will be the inside of that tendon, and sometimes on the anterior side, so the front of the tendon. So you got to make sure you're able to get into that front side and work on doing cross-friction stuff or deep tissue massage to break down that scar tissue or the thickening and adhesions. So if I'm doing it, if you have that second person who can help you out as I'm doing for her, I'm going to get in there. And remember, it's not just moving on the skin. You got to put a little pressure on that spot. I put a little tension on through here. I'm going to put her in dorsiflexion, or bring that foot up, so you can see how that makes it a little bit more tense, that tendon. So I can get into that back part of that tendon or the outside and on the inside a little easier there. So I'm going to work at going up and down. I can go side to side and various directions. So look at tender spots and work on that for 5 to 10 minutes to break down that thickening. And you might find you might have more than one spot. So you might have to jump around, go from inside to the outside to really hit those spots. Now, if I want to get more in the front of that tendon, I got to put a little more slack on through there. Otherwise, it's hard to get in there. So now I bring that foot down. I got more slack through there, so it's a little easier to get on the anterior front side of that tendon. So now I can get in there in the front side, and I can do the same thing. I stabilize through here, and I can get in there and work on doing some massage through there, back and forth, up and down. Okay, so that's the cross-friction massage part. The second part is doing some tack and stretch or pump massage to that tendon and that muscle and that soft tissue. So here I can do is I can hold on to the foot, I can tack it down, so I hold that tendon down, and I can work at stretching, right? I can go up and down in different spots, so I can isolate here, I can push down a little, stretch, and I'm going, basically I push down, I hold the position, I push with my other hand, so I'm stretching that tendon and all the various soft tissues along there. If I want to apply a little more pressure through there, I can use my body, I can lean into it a little bit and I press as I hold. I can even use both my hands and I press and I stretch, press and I stretch, press and I stretch, all the way through and all the way to the calf. So I can really get in there and I can stretch various tissues through there. Okay, so you can I can apply a lot more force this way as I'm doing mobilizing or stretching out those tissues. Okay, so don't forget to, even though your problematic areas are here, you got to really look at what's happening in the foot, why the problem's taking place. You got to look at also further up in the chain why the problem's taking place. You got to also do remember, always treat above and below the area to figure out and remove the cause of the problem, why that's happening. Okay, and also do the soft tissue stuff, not just here, work up through the calf, as I was doing, to free up tissues all along that area. So you improve the circulation, you promote the healing process, and help reduce pain and just help you get better faster. All right. Hope you enjoyed that video and you found it useful. So try it out and leave a comment if you have any questions. Make sure you subscribe to the channel and check out the site. Click on the link to check out the site. I have tons of information on it. We got a really cool program that's coming up soon. So stay tuned and keep checking out the site. All right. Thanks, guys.